Thanks very much, Sheila. So, hi everyone. My name is Rashad Bayat. I'm a family physician with special interest in digital health and senior clinician leader at Canada Health Infoway, and I'll be moderating today's session. So today we're going to be hearing from clinicians firsthand on how they are using connected systems to streamline their prescribing processes and enhancing patient safety. Our panelists today are all passionate Prescribit users. But before I introduce them, I just want to provide a brief overview of what Prescribit is and its benefits, and then we'll dive into our moderated panel discussion. So Prescribit is Canada's national e-prescribing service. It allows the secure transmission of a prescription from a prescriber's EMR, electronic medical record, or hospital information system now, to a pharmacy's PMS, a pharmacy management system. Prescribit workflows are fully integrated into the systems that clinicians use, so there are no separate portals or logins or passwords necessarily to remember for Prescribit. It enables the transmission of discrete data elements of the prescription, so it's not a fax or electronic fax. So Prescribit is a pretty unique example of interoperability in action. It is one of the most interoperable platforms in Canada, connecting 16 electronic medical record systems, 9 pharmacy management systems, PMSs, and 2 hospital information systems. And you can see here that the momentum continues to grow with more provinces going live, more pharmacy sites coming on board, and more prescribers enrolled. But why does this all matter? Well, Canada isn't the first to implement e-prescribing, and the benefits of e-prescribing have been studied and established. It does offer substantial cost avoidance and patient safety benefits nationally at scale. So these savings and the patient safety benefits manifest in the following ways. So number one, reducing prescription misuse. By increasing the security of the transmission of prescriptions, we can reduce fraudulent and diverted ones. Improving medication adherence, particularly first fill adherence. By improving the information provided to clinicians in the circle of care, we can also enable them to act on that information to improve medication adherence additionally. Reduction of medication errors. These errors would otherwise lead to ER visits, or could otherwise lead to ER visits and hospitalizations, I should also say ED visits. By sending discrete data elements instead of images of faxes, we can reduce and eliminate transcription errors that might otherwise occur, thereby reducing, again, these potential medication errors. In addition to all of this, we are also hearing directly from our users that Prescribit adds value every day. So customer feedback really does help to drive the Prescribit service and is the basis for continuous improvement. The team is constantly trying to leverage direct feedback from users to improve and enhance Prescribit. So we talk to those using the service in a few different ways, whether that is through our clinician advisory subcommittee that is made up of physicians and pharmacists, including Dr. McCallum, or through broader surveying of current users through our performance team and the Prescribit team. Our most recent survey of Prescribit users really highlighted the many ways clinicians are benefiting from e-prescribing. So in the interest of time, just keep it pretty high level. So over 80% of prescribers and 70% of pharmacists say e-prescribing is the better choice for efficiency and productivity, that it improves clinical workflow, reduces paperwork, and helps to support more efficient care delivery. Over 65% of prescribers and pharmacists say e-prescribing is the better choice for patient care, that it enhances remote work, so truly virtual care. It improves the effective delivery of that virtual care and supports the sharing of patient information between clinicians, which we'll actually hear about in our panel discussion. And over 75% of prescribers and pharmacists in these surveys say that e-prescribing is the better choice for controlled substances, that it increases the confidence in sending and receiving controlled substance prescriptions, reduces the likelihood of prescribing, transcription, or processing errors relating to controlled substances, and also reduces the number of stolen or fraudulent prescriptions. But that's enough for me. Let's hear from our panelists. And today we are joined by Dr. McCallum. So Dr. Eileen McCallum is a primary care physician now practicing in Edmonton, Alberta. She entered private practice in 1992 with a solo practice located near the University of Alberta with privileges at the Grey Nuns Hospital. She spent some years in California where she established a new practice and continued full service family practice, including care for hospital patients and delivering babies. That's a lot of full service. She also served as a preceptor for many nurse practitioner students. She was also the founder of the Heart Clinic, focusing on anticoagulation patients as well as diabetes education. She's been an early adopter of electronic health records and electronic prescribing. She also received the 2010 Excellence in Public Health Award from the County of Shasta for her educational outreach regarding the H1N1 influenza outbreak. Dr. Eileen Callum. Cole Mondor is a pharmacy manager, partner, and licensee for Mint Health Plus drugs based out of Edmonton. He spent a decade working with marginalized populations in Edmonton's inner city, including patients who suffer from mental health conditions and substance abuse disorders. His primary practice sees a high volume of prescribed transmissions, which has significantly improved pharmacy workflow and communication and collaboration with prescribers. Dr. Scott Wilson. Dr. Wilson is a practicing neurologist in the Calgary area. He has been advancing information technology for physicians since 2005. He was involved in POSP, the Physician Office System program to computerize doctors' offices, and has remained as an advisor to the Alberta Medical Association for Information Technology. He now sits on the board of directors for the AMA and was one of the first users of Prescribe It. So just so folks are aware, just doing a quick time check, for the next 25 minutes or so, we'll moderate and have this discussion with our esteemed panelists. For each question, I'm asking that the panelists keep the responses to around 2 minutes or so if possible. And if there is time at the end, we'll aim to take some questions from the audience as well. And there should be mics out in the crowd for that. So Cole, Dr. Wilson, Dr. McCallum, can you please describe for us how you use electronic prescribing in your practice in the present day? In what ways would you say Prescribe It affects and impacts your efficiency, workflow, and your management of prescriptions going out to the pharmacy and coming back from the pharmacy to physicians' offices? Perhaps we'll start with Cole first on this one. Sure,
yeah. Obviously, I can certainly speak to Prescribe IT transmissions coming into the pharmacy. So my practice, as Rajat had mentioned, being in Edmonton's inner city is strongly focused on mental health and addictions. We do a high volume of prescriptions within that field, and we're close in proximity to what's called Radius Health and Healing Clinic. They're sort of a one-stop shop inner city clinic for the underserved demographic. And so as a result of that, a lot of what we're seeing being transmitted to us are controlled substances and narcotics. So lots of OAT, methadone, Suboxone, and other types of narcotics. So for those transmissions, to start on that point, it's made the receipt of those prescriptions significantly more, accurate, safe, and I guess thorough. Prior to that, we were often relying upon, triplicates being faxed directly to the pharmacy, which required a lot of staff overhead from the physician side of things, as well as our side of things to kind of, input those into our pharmacy management system, so on and so forth. Beyond that, just for non-narcotic medications, it's really helped sort of streamline workflow. So instead of a prescription coming in via fax machine, somebody grabbing it, having it input into our PMS, where we're having the patients, starts with the patient's demographic information being transmitted over to the pharmacy. From there, we kind of confirm all that. We then immediately have the order from the physician. Our system tries to link it to what drug it believes the physician is selecting. We confirm all those details and we kind of complete the input. So what previously was a 5-10 minute process for an average prescription has gone down to 30 seconds. So for us, the benefits have been many-fold in terms of efficiency and safety. Yeah.
Dr. Wilson?
So to echo his points, from a physician side, for what I do, a lot of my practice, for example, will be migraine and epilepsy, where I prescribe a lot of these medications. Often, I'm not going to be as big a volume prescriber as some of my primary care colleagues, but I noticed right away just the efficiency in my office for prescribing. So if I have a favorite medication that I use all the time, even some of the newer ones for, let's say, migraine management, then I can pull that up very quickly. And if there's 1, 2, often there's 3 medications I'm prescribing, then I can electronically send it to the pharmacy, and adding the pharmacy, now the registry of pharmacies and the address book has gotten bigger and bigger. I use a system called MicroQuest, and they've been an excellent partner in this in Edmonton. I think one of the first to go live with the platform in Alberta, and it's worked seamlessly from day one. Only in Alberta, we have a Netcare. We have a Netcare system whereby I've even prescribed something and the patient hasn't left the system, and I can already see it on the provincial system before the patient has left the office that it was seen by the pharmacist and technically dispensed.
Excellent. And Dr. McCallum?
And I'm just going to echo my colleagues as far as how much we love Prescribe It. I'm a huge fan, and I just thank our Prescribe It partners here for all the work that they've done. And yes, it's a huge difference in my office as far as efficiency. My patients love it. They love that they don't have to take a written prescription, a piece of paper to the pharmacy to be then wait around for or come back the next day. It's actually in the pharmacist's hands even before they've left my office. So as we're chatting and I'm charting and I've sent their prescription, and some of my newer patients will say, well, weren't you going to give me a prescription, doc? And I say, no, it's actually already at your pharmacy, so just head on over there. And they love it, and I would never go back.
That's really awesome to hear. All of you, hearing these comments on efficiency, workflow, and some change, kinds of discussions that you have to have with patients as well, to kind of sort of educate around how things are working in this new paradigm. We often hear, from physicians and pharmacists alike, that controlled substance prescribing is an area particularly in which e-prescribing can support clinicians, whether with regard to security and safety, reduction of fraud, or increased confidence. And I know, Cole, you touched upon this already, and you alluded to something really interesting that I thought might come up organically in the conversation, particularly for Alberta. But really, wanted to ask, could you, some of you provide some examples of generally how you are seeing benefits from your perspective? And I think, Cole, we heard a bit already from you on this one, so we'll start with Dr. McCallum first on this one.
Yeah, and I'm going to echo Cole's comment about how it takes 5 or 10 minutes to take care of one of those prescriptions. And from my end, using the tracked prescription project, or TPP, I think, it takes probably 3 to 5 times longer than just writing a prescription, because you have to write it out in triple. And then the patient has to make sure that they take both copies, and it has to be there in a certain length of time. And there is that concern for diversion and fraud. So having that taken away and just send it electronically is a huge, huge improvement.
Excellent. And Dr. Wilson, did you want to weigh in on this? Or you can always defer.
Maybe for the audience, Alberta is maybe a little bit unique. It has a triplicate prescription program. So for controlled substances, you had to do 3 copies of a prescription. 1 stayed with the doctor, 2 went with the patient, and 2 went to the pharmacy. Is that correct? Yeah. I'm not a big narcotic prescriber. It's just not part of my practice, so I haven't had to do it. But fully have been at circles where we've been trying to endorse this and change this, and I think that this is certainly game-changing from that viewpoint. So I'll let Cole speak to that a little bit more.
Yeah, I did get ahead of myself a little bit there, but look, this has been one of the largest benefits for my side. Has simply been the sheer convenience that Prescribe It has offered from a controlled substances perspective. The TPP process for us was, in addition to from your guys' end, was, pardon my French, but a pain in the ass. Like we would receive 2 copies of a prescription. We'd have to get the patient signature on one. We'd have to retain one for our records, keep them for X amount of years. And it was a long process. And as a result of the Prescribe It change in my practice, we're now receiving those instantaneously, able to do a patient verification without needing a signature from them. And again, I think I alluded to this on your first question there, Rashad, but particularly for our environment, not having often patient identification and having to largely, make some assumptions about who a patient is, maybe using some demographic info from them, but I guess, benefit from a fraud perspective has essentially taken it to zero in our practice. Yeah, so it's been a really welcome addition in that regard.
Thank you, Cole. Thanks, everyone. And it's really interesting to note, and especially considering there are other provinces that do have similar policies related, similar to Alberta's in the sense that they use a type of a TPP, a triplicate program. And so there are some learnings about how, a new tool like this could be adapted to help perhaps displace or modernize how that is done. So I guess we'll move on to our next point of discussion, especially following the pandemic. And we've heard elements of this earlier in some of our other talks today. It's really important to provide access to care and to digital tools for all Canadians, regardless of where they live. The essence of virtual care when it is available and trying to really live up to that quintuple aim that we are striving towards. Electronic prescribing is one way in which we can ensure that all patients, including those living in rural and or remote settings, those also that might be displaced by climate disasters or climate change types of issues like wildfires, or just those living outside of a practitioner's geographic region, that those people are still provided with equitable access to care. So I'm wondering today, if our panelists might be able to comment on any experience they have in this domain and touch upon how e-prescribing facilitates patient care in a variety of settings and situations, particularly, relating to vast geographies that we have in Canada.
Well, maybe I'll go first. As a specialist, I have a large catchment area, so I'm practicing Calgary, but really I see patients throughout central Alberta, all the way into British Columbia. Unfortunately, British Columbia doesn't have the Prescribe It program going as much. So this is a plug for it to move forward. I will unabashedly say it works and to try and move it forward. But it is, instead of, COVID taught us, why would I hand you a prescription, then you have to go sit in line at the pharmacy to wait to go pick up your medicine, or then go back, wait to pick up your medicine and go. If you just think about it, it totally makes sense. So, I agree with my colleagues here that, send it electronically, they go pick it up. I mean, I have had instances where I've been in my office, patient has come from 2 hours away. I looked, it was such a joyous thing. I'm looking on the system, and there's Trochu, Alberta, and the pharmacy there, and boom, the prescription was there and in the hands of the pharmacist before the patient had even walked out the door for a kind of a more critical migraine incident. So it's really good, from that perspective. I do use it across borders. So I have some patients in Saskatchewan that have been on, where the pharmacies, so you can search through the tree and look by province. Even a couple of London drugs that have been in Alberta or in British Columbia, in Vancouver, I've been able to send prescriptions because I know the patient was flying to Vancouver, so I could actually say, and then I'm validated as a physician licensed to prescribe this medication. So they went to the pharmacy here downtown to pick it up.
It's super cool, and it's in this new dynamic, as we go through digital transformation, it's getting us to rethink care models and how care can really be delivered using the right tools. So thank you, Dr. Wilson. And Dr. McCallum?
Yeah, I'm just thinking about the wildfires in Alberta and the displaced people in Alberta. And fortunately, not many of my patients were displaced that way. But I do have an example of a patient that was on holiday in Ontario and called me and said she'd ran out of her prescription and needed something refilled. And, the joyful thing was that I was just able to change the pharmacy from her usual preferred pharmacy in Edmonton to drop-down list, find the one in Toronto, and boom, there it was. And it was at the pharmacy in Toronto before we even got off the phone. So that was very easy.
Versus the alternative was Googling the fax address of the pharmacy in Toronto and sending it by fax and everything else. Like whether I'm doing it or my staff was doing it or whatever. I mean, this is a game changer for it. And I would say for the patient perspective too. I mean, eventually it could be that the patient actually has this, can drop down and see, I don't know exactly how that will work. But for the system, we are sending the pharmacy, but it does go up for those, and it does go up into the cloud. So the thought is that a patient could go to a pharmacy of their choice if they didn't know where it is, and actually present the barcode that's on the prescription, and then they can take it anywhere that they need, and it's all validated and go from there. Were we going to talk about renewals?
So I think we were going to get to renewals.
Yep.
Yeah, you can. We're always, if you want to.
Well, while it pops into my head, I can't say how much easier it is. Instead of a fax coming into our office, we were both talking about this. Someone then has to assign that to a patient in your EMR, and then you have to look at it, and then you have to manually rewrite the prescription in Prescribe It, and then or your electronic prescription or your EMR, and then send it out again. And for me, it is a game changer. As I use a lot of migraine medication, patients go through it, and we all have renewals. And now they're coming in electronically, and I can just say accept. And if there's some query on the pharmacist end, I have had Dr. Wilson, this patient is taking more medicine for their Parkinson's disease. Do you agree? Can you review with them? And then easy 1, 2, this is where we truly start to see teamwork approach in terms of patient care management. With the patient at the center, they can tell this to the pharmacist. And we all know how much primary care is hurting right now, and that more of this should take place. This is one of these ways that this is going to occur.
I just want to add to that. From our end, I've seen a significant amount of improvement in terms of efficiency of communication from prescribers to us. Previously, we would have sent off a fax. It would have gone into a fax pile. Somebody would have triaged it to you. Would have got onto your desk. Maybe you would have gotten to it hopefully by the end of that day, but often not. Probably not. And so in our case, it's so simple to just jump on there, fire you off a quick message, mark it as urgent if need be, and in many cases, we're getting a response back for critical items within a few minutes. We benefit, you folks benefit, the patient ultimately benefits from that level of service and care.
Thanks, Cole and Dr. Wilson and Dr. Callum. It's nice to hear that theme of communication emerging as well, and efficiency again around the renewals. Communication in particular, when we think about the theme of this conference and a lot of the work that we're all working towards in terms of interoperability and enhancing team-based care, it's really nice to hear that theme emerging. So I'll just switch gears a tiny bit here, and we're going to head over to Cole to kick this one off. But Infoway's been looking at ways in which Prescribe It can support clinicians in their additional ways in which we can support clinicians in their practice. And one of those areas is related to the expanding scope of practice for pharmacists that many of you in the audience would be aware of, having taken place over the past few years, particularly as it pertains to patient assessments, pharmacy prescribing, associated administrative requirements as well. And so from your perspective, are there ways in which Prescribe It does or could provide tools to best support clinicians in this area? And Cole, again, looking to you to start kick us off on this one.
Yeah, the important part, so being in Alberta, our scope of practice for pharmacy practice is, I believe, the most progressive in all of Canada. So we are well versed at this point in time in prescribing, renewing, adapting, prescribing in emergencies, so on and so forth. Part of the requirement of performing those services is providing ample notice to the patient's primary care provider. So for us, that's another I guess administrative duty that's required of us when we're making a change, initiating a therapy, what have you. Prescribe It makes it very, very simple to do that in terms of just that level of communication that we were speaking to prior. So that's been a great benefit of it. Another that I haven't seen yet, but we had talked about previously that I'm looking forward to is the ability for pharmacists to actually send in a prescription via Prescribe It. I think in Alberta anyways, and I believe in more and more provinces, we're seeing primary care gaps being filled by pharmacists, including some pharmacist-led clinics. So the ability for pharmacists to be a part of that ecosystem would be extremely valuable.
Thank you for those excellent insights. And I should also just share with the audience that the Prescribe It team is sort of in the midst of conducting some exploratory work in this area, and so we may be tapping Cole on the shoulder again. We've set up an ad hoc committee that will be looking into the associated administrative requirements for pharmacist prescribing and detailing where Prescribe It could currently support or perhaps support in the future with future functionality to support pharmacists in this area. And on that note, looking towards the future, while Prescribed's initial focus has been up to this point in the community setting, we are now exploring and have been exploring other settings, including hospitals, for example. From your perspectives, what do you see in the future of digital healthcare delivery, and how can electronic prescribing and the functionality enabled through Prescribe It support healthcare delivery in each province and territory, but also across the country for Canadians? And maybe we'll start with Dr. Wilson first.
Thank you. So I've been involved, I work in the acute care setting as well as a community setting, so I live in both worlds. Alberta is fortunate enough to have gotten the whole acute care system on Epic, which is called Connect Care, very apropos to the Connect Care conference that we're at. So essentially every acute care hospital in Alberta is on the same system now. And I've been a big proponent in working with the senior leaders at Alberta Health Services to try and get this going, and Infoway has definitely had this on their radar. I know that there's been some implementations in Ottawa, and they have been talking. Truly, Alberta just went through the last big wave of implementation, and hopefully this will move forward. But in my world, if someone comes in with an acute myocardial infarction, acute stroke, very serious sort of multiple sclerosis, and is going to go, we all know that they're going to leave hospital on 10 new different medications often. And wouldn't it be great? Or they come to the emergency and it's acute, and they need to go on an antibiotic, they need this tonight or whatever, instead of that faxing and everything else, where that kind of end-to-end order entry connected to. So, what we see on our end is truly that, I know in my EMR, and I would know, presumably in Epic and Connect Care, that prescription was sent and landed in Cole's, pharmacy. And, that is great. And we actually know that it's dispensed. We know that the patient actually got the medication record, and that renewals are dispensed. So you can track the patient's compliance with their medication more than ever before, which I think is ultimately, for those that don't comply, it does give us a helping hand in actually knowing that. So I think it's a great benefit, and we will move forward with this. I think it's one of the next big steps.
We're starting to see the future emerge here. Dr. McCallum, any thoughts yourself? Well,
yeah, just to pick up on Dr. Wilson there, that information is available when my patient does go to the hospital and gets discharged with numerous different medications. It's often sent to my office, but it's something that has to be integrated by me. So having it actually being integrated into that chart automatically would be wonderful. That information is sometimes siloed, and in prior talks today, we were looking at how siloing of information doesn't help our patients. And so if we can actually integrate that into that one patient record so that we're all aware of what happens with our patients in real time, rather than having to go, oh yeah, the family member calls us and say, that patient was admitted to hospital, and now I have to go and look to see what's going on. That's going to really help with patient care.
Thank you. And Cole?
I don't know if there's any other pharmacists in the audience, but from my end, there's nothing worse than receiving a hospital discharge on a Friday at 4:55 p.m. and we close at 5 o'clock, and there's 15 different medications on it, and some of which we don't have in stock and we have to order, and there's a clarification required, and yada, yada, yada. I think if Prescribe IT or something similar would end up in the hands of hospitals, the transmission of information from hospital setting to community and the care provided by pharmacies would improve significantly as a result of that. Just the ability for us to see those things in advance, have a little bit of forewarning, would mean a better outcome for the patient. Not only that, but like going back to the communication aspect of Prescribe It, if we had the ability to easily reach out to that hospital provider and get a response or a clarification on something, it would make a world of difference. Whereas currently, at least in Alberta, it's often quite difficult for us to do that. Yeah.
Thanks, Cole. And again, I think we've got glimpses of the future of medication management here with more of the right information being available at the right time to the right people involved in patient care. So just looking at the clock here in terms of the time, I think we do have time for another question and topic of discussion. So, as a physician myself, there is a common theme in the clinical space these days that many of you are hearing about or have heard about and even heard about earlier on today, and that's the administrative burden that is plaguing primary care in particular, but many other clinical settings. And I don't want to steal too much thunder from tomorrow morning's session, which will delve into this in more detail with doctors of BC. But I'm wondering, Cole, Dr. Wilson, Dr. McCallum, are you seeing the administrative burden being experienced by either yourselves or your healthcare colleagues? And do you think there are or might be ways in which electronic prescribing could help to alleviate some of this burden? And I think we've heard you touch upon pieces of this already. If there's anything you can add to what you've already said, we'll start with Dr. McCallum first.
So I think the administrative burden aspect of it hits doctors with the too many clicks. There was so much talk a few years ago with EMRs and too many clicks to get anything done. And so a lot of work has been done in that area. And I think Prescribe.it has really done a great job as far as reducing the number of clicks that we have to do in order to do anything. But I mean, when you even look at a non-Prescribe.it electronic prescription, even if you're not physically faxing that, if it's an electronic fax, it's still too many clicks for me. I mean, it's too many screens to go through to get anything done. So the fact that that's just removed from the equation with Prescribe.it, I think, is wonderful. And any of that, reducing our administrative burden, is going to be helpful.
Excellent, thanks. Dr. Wilson?
Well, just to advocate for it, it is so nice to hit one button, e-sign and send, and it's gone. And you just go, wow, and then there's a little success. And it's like, yay, I've done something good today, and I've advanced the system and better for everybody. So I just want to say it works. It's easy to use. There's no reason we can't move this forward, and it really is becoming the standard. And it's kind of one of those pillars of what we do as physicians and pharmacists, and wholeheartedly can't say enough about the support for it.
Cole?
Yep, I'm just thinking back to pre-Prescribe.it and earlier days of pharmacy, and don't know how many of you folks are familiar with that environment, but often you walk in and there's colored baskets like a mile high all the way up to the ceiling, and each one represents sort of a different timing for when that prescription has to get out, the level of urgency to it. In a small dispensary that's pumping out a high amount of volume and trying to do so accurately and without, doing so accurately without harming a patient, that's not exactly conducive to that outcome. So Prescribe.it has significantly improved our ability to accurately dispense prescriptions, just from the perspective of having an electronic triage prescription for things that are on the inbound. So having it there and knowing that it's accurate and we don't have to go through the input process and there's no human error, or I should say less human error associated with that, it's made a world of difference for us.
Everybody does their office workflows. We know for physicians differently, but in my office, it's been phenomenal for my nursing staff and for the MOAs, everything. They love it. They cringe now, oh, I have to find the fax, that kind of thing. So, we have a workaround. I do the final e-sign and send, but they tee everything up for me. I mean, it's made it so much easier. And to speak to Cole's point, I mean, that was the thing. A fax comes in, it sits there, someone has to triage it, and it may not be the most urgent thing, but this way it's just kind of there and we can deal with it right away.
Or it gets lost.
Yep.
Thank you so much, panelists, for this great discussion. It's been really excellent to hear how e-prescribing is benefiting those using it every day, and to hear the passion in your voices. I can hear it and feel it. We do have a few minutes to take some questions from the audience. So I'll ask that if you have a question, please, I guess, find a mic over there, and over there, please. Questions from the audience? Simon, yes.
Thanks, I'll throw it in. Yeah, digital health solutions always scale more slowly in Canada than we'd like. So from your perspectives, what could we do with Prescribe.it to help it scale more quickly?
Fantastic question. I'll open it up to any takers on our panel.
This? I mean,
This is great,
yeah,
great.
I think just advocacy, like having users be involved in the advocacy process. Okay, can't say much more than that. That's, yeah.
Dr. Wilson?
Education
Dr.
of patients and to ask for it, and doctors to know that it exists, that it's easy, that it's not going to be a huge burden on their practice to implement. And then, you know, as more pharmacies get signed up, there will be more incentive for doctors to actually be able to use the service.
I think one of the barriers to adoption, well, there's been many different barriers, and I probably know too much. I could do a whole lecture on this, but Dr. Affleck actually and Gary succinctly gave us a real review of all of those things that are not working from an interoperability standpoint. But we really have climbed over the tipping point. The amount of pharmacies that are now is just more and more and more and more. In Alberta, there's really sort of two big chains, I think, that are left to go, and they're sort of in the pipeline, and it just makes it easier and easier. So, you know, we really have reached that point, I would say. From a physician viewpoint, you know, to work with the provincial medical associations, they're probably the best way, and some of the, you know, primary care leaders and things like this to move it forward. So the peer-to-peer education of physicians, that's what works the best. And I'm assuming for pharmacists too, like there's nothing like a physician going and saying, well, this is how you do it. Then everybody does it, right? You know, it's literal. But I mean, that has to come at multiple different levels. And unfortunately, it's an ongoing, it's not just a once and we're at one time and we're done. It's an ongoing evolution that we have to look at. So very critical from that viewpoint, but we will get there.
I'll just add to that. Dr. McCallum had asked me before this session, what is the barrier in pharmacies to implementing this? And my answer was that there's very little. There's very little barrier. Perhaps the only thing is a small cost, but that's at least, well, throughout Canada is being supported by a grant as far as the cost to implement it in the PMS. But beyond that, pharmacies, I had indicated, like they're just well-oiled machines, and managers and licensees are just scared of implementing something that might throw a wrench into their otherwise well-functioning workflow process. And so the more that we can be out here advocating for its functionality and its efficiency, the better.
Thank you. And we have one more question.
Thank you. I am a pharmacist from Saskatchewan. And my question was very similar to the one that was before me, is why, you know, we have such a slow uptake. But my one wonder is, are there tools that you feel that could be put into Prescribe.it that would make it even more functional and more easier for physicians and for pharmacists to use on a daily basis that would be just right at your fingertips? Thanks.
Thank you. Open that one up to the panel again.
Probably drug-to-drug interactions as a flag, that would be great. And flags for polypharmacy to remind us that maybe less is more. And then in the future, being able to have that access to the recent labs to be able to say, you know, your dose is too high because the kidney function is poor or whatever. Have that as an advice to prescribing, that would help.
Cole, Dr. Wilson?
I would add to that, to piggyback off of the question from yourself earlier about the expanded scope of practice, would be tools that allow our actions to precipitate something on the physician's end that they can see as far as an intervention we made. So if we make an adaptation, they can see that documentation rate in the EMR, they can see the prescription that we've initiated as an alternative to theirs. Currently, we can provide a communication electronically in the form of a message, but it's not fully integrated. So That's what I would like to see.
Yeah, I think what you're really talking about, that higher level, and there's probably different ways to look at that, but full medication reconciliation, that when a change is made at the pharmacy end, as we go down this pathway, or some other physician's office, depending on who's identified as the primary caregiver, and then there's notifications received. If we start to tie that in, that goes, and actually, to tell you the truth, then, even patient care summary that's been very active, that I've been a big proponent for in Alberta, this should just tie right into it. Of course, each provincial system is a little bit different, but on a national standard, this is what we should be aiming for. I think there's there's some ways to go to make it. So I was ordering 25 milligrams of an oral drug, but and I still have to put one tablet in, you know what I mean? It's like, well, I'm ordering one tablet, I'm picking that dose, I think we could even go a little bit farther in terms of, if I want to change it, that's fine, but just making sure everything's a little more, like that, rather than just the drug. The drug database that is included is excellent, updated all the time. So it does make it easier, because sometimes, okay, I haven't ordered amoxicillin for 5 years, how much do I need? And then, it's like it cues me, and then I can confirm my dose and go from there. So we're starting to get a little bit of that in terms of that. But medication reconciliation, both with provincial systems and other colleagues, would be the next best level.
Some additional interesting food for thought there as we start to approach the potential for critical mass. All the ideas start bubbling up. What could we do now that we have lots of people on the service? How can we make it better? So great question, great answers. Thank you. And I think we have time for one more question. Dr. Figursky.
Hey, I was wondering if anyone's ever looked at using the fax number itself as a VPN or secure IP, where it's seamless to the doctors. They don't even know that it's passing through a provincial pharmacy. They assign all those DID, those numbers, to the pharmacy of BC or Pharmacist Association of BC. If you're the pharmacist, the College of Physicians, if you're a doctor, you'll never send a fax to the wrong place, because it'll just be these dedicated numbers, and the workflow doesn't change in the office.
I actually don't have the answer to that and don't know. It's a really, really good question. There might be somebody from Prescribe It in the audience, and Dr. Wilson.
I think the difficult with that, you're still going to need on the back end some sort of federated address book of who's who in the zoo. And it's very difficult to do. This way, it's all secure. And, unfortunately, we want to get away from the fax. It's far better to go. We can axe the fax and move forward.
Yeah, we are one of the last remaining industries that relies on the fax machine. I talked to a lot of other people in other industries that haven't used a fax in years. So.
Excellent. Yes, continue that transformation away from the fax. It's, however, there's some interesting elements to that question. So, Dr. Figursky, I'll follow up with you after just to dig into it a little bit more. That's really neat. So I think with that, we've probably just about exhausted our time. If there's no other questions, I just want to extend a huge thank you to our esteemed panel, Cole, Dr. Wilson, Dr. McCallum. Thank you for giving us so much, again, food for thought on the advantages and enormous potential for prescribing and electronic prescribing in general at scale across the country. And on behalf of Infoway, the Prescribe It team, and as a fellow healthcare practitioner, I want to extend a huge thank you for your support for Prescribe It and your invaluable contributions to healthcare just generally. Thank you so much.